Hello everyone and welcome to ENT students, and now I'm going to talk about vertigo. Um, the most common symptoms with which the patient comes to the OP are the discharge from the ear which is otorrhea, and pain in ear which is otalgia, and deafness, tinnitus, vertigo, autophony, facial nerve palsy, fever and headache. And the disorders of vestibular system causes vertigo, and they are of two types, peripheral and central. And the peripheral one involves the vestibular end organs and the first order neuron, that is the vestibular nerve. And the cause lies in the internal ear or eighth cranial nerve, and these are responsible for 84% of the cases of vertigo. And the central one involves the central nervous system. After the vestibular nerve enters brainstem, and it also involves vestibulo-ocular, vestibulospinal, and other pathways of central nervous system. And some of the peripheral causes of vertigo are Meniere's disease, benign paroxysmal positional vertigo, vestibular neuronitis, labyrinthitis, vestibulotoxic drugs, head trauma, perilimb fistula, syphilis, and acoustic neuroma. And some of the central causes which the lesions which involve brainstem and central connections are vertebrobasilar insufficiency, posterior inferior cerebellar artery syndrome, basilar migraine, cerebellar disease, multiple sclerosis, tumors of brainstem and fourth ventricle, epilepsy, and cervical vertigo. And the other causes other than the peripheral and central causes are ocular vertigo and psychological vertigo. And while examining the case, the following points should be observed, that is, present and absence of discharge. If any discharge is present along with the vertigo, then it indicates the intracranial or threatening intracranial complications. And the type of vertigo, that like if the patient himself is moving or the surrounding is moving, or any sense of unsteadiness or any sensations of to and fro or up and down movements or falling off suddenly, and all these types of vertigos are seen in Meniere's disease. And vertigo in particular position, the benign positional paroxysmal vertigo causes vertigo in particular head position. And the vertigo with deafness increases before the onset of vertigo and Meniere's disease. And vertigo without deafness, it occurs in vestibular neuronitis. And vertigo associated with neck movements in cervical spondylitis, compression of vertebral artery by osteophytes causes vertigo. That's it. Thank you.